Canada's Public Health Agency has bought 500,000 doses of bird flu vaccine. They're calling it a proactive measure to protect people who might be at risk of exposure. Dr. Richard Webby is director of the World Health Organization Center for Studies of Influenza in Animals and Birds. And thanks for taking the time for us today, Dr. Webby. Much appreciated.
You're very welcome.
You've been watching this virus for decades. I just mentioned what our public health agency is doing. Your thoughts on the idea of trying to have 500,000 doses just in case, to try and prevent perhaps another pandemic?
Yeah, from my perspective, I think it's a great idea. To be honest, we don't know if this virus is going to become a pandemic. Is it going to be tomorrow? Is it going to be 3 weeks? Is it going to be 6 months? Or possibly never. But I think anything we can do to prepare for the possibility makes a whole lot of sense. And right now, this virus is very, very active. So I think now's a good time to act.
Yeah, we know, of course, that poultry farms are culling much of their flock as a result of this in parts of the United States. You've been watching this virus for decades. Can you tell us, sort of in layman's terms, how it's changed, how concerned you are that there could be some kind of a bird flu pandemic, Dr. Webby?
Yeah, so this virus has been around in one form or another since really the late 1990s. So it's not a new virus to the world. It's a new virus to North America. That virus came over into this part of the world in late 2021. But the current version of this avian flu, or H5, seems to be able to spread much wider than any of its sort of forefather viruses that came before it. So lots more activity in wild birds, and with that, we're seeing the spillover into poultry, as you mentioned, into cows down here in the US, and with that also some spillover into humans. So that activity we just really haven't seen, even though it's not a new virus. So times are very much different at this stage.
Tell me about human-to-human contact and the spread of avian flu to humans to begin with. What can you tell me on that?
Yeah, so right now we're lucky in terms of we've seen spillover from infected cows or birds into humans, but we haven't seen that human-to-human spread. And of course, that's what's separating us from a pandemic. We and many others are continuing to monitor this virus to look for signs that suggest it's changing to a form that could be more transmissible in humans. But right now, it's not there. This is a virus that is still really a bird virus. It would much prefer to be infecting birds than infecting humans. The problem is it could only be 1 or 2 mutations away from changing that, and that's what's got us worried.
Dr. Richard Webby, director of the World Health Organization Center for Studies of Influenza in Animals and Birds. Dr. Webby, thanks for taking the time joining us from Memphis, Tennessee. Good to have you with us.